You know, while hysteria is rarely appropriate, fear of the coronavirus actually is reasonable, and fear of Trump's incompetence is highly reasonable. Check this out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. And this was planned like a year ago, to go to Europe this summer in June or July. And they were both. She's a nurse at a big hospital here in town, and he's an engineer with an international company, and both of them were advised that if they leave the United States, if they travel to Europe, when they get back, they're going to have to self-quarantine for 14 days. New company policies. I mean, this is like I said, social distancing is the hot new phrase. Louise and I pretty much stopped going to restaurants until we get enough test kits here in Oregon to know that it's safe. And, you know, just where'd this story go? Here it is right here. This from this morning's Oregonian, our local newspaper, right? Or, you know, I mean, it's owned by a New York company. What can you say? The Oregon Health Authority will run out of coronavirus test kits by Wednesday without an infusion of kits from the federal government. The state lab had just 130 tests remaining as of Monday night, according to an agency spokesman, and translates to about 65 people, given that it takes about 2 tests per person to diagnose the disease. State officials say they're confident that more enzymes will arrive from the Centers for Disease Control and Prevention on Tuesday and Wednesday. If and when that happens, state officials say they'll have the capacity to test about 4,800 people. The state originally got 1,500 tests, so apparently that's enough to test about 750 people. And we have 14 confirmed cases here and 52 people awaiting results. Now, I got the email. I'm on the Oregon Department of Health email list yesterday, and they said there's several hundred people who are in self-quarantine because they are symptomatic, but they haven't been able to test because they don't have the test kits. So, you know, bottom line, Louise and I are just saying, you know, we're not going to go out until we get enough test kits in this town that we can get some kind of sense about, you know, whether the, you know, it's how many people in Portland are infected. Is it 3? Well, we know it's like, you know, it's more than that, but, you know, is it hundreds? Is it thousands? Is it just a few dozen? I mean, should we be concerned about it? We honest to God don't know the answer to these questions because the Trump administration has been so incompetent at this. They've known since November that this was coming. They've known since January in a big way that this was coming. That's when we started seeing cases popping up in the United States. And what has Trump done? Nothing. And what did he do today? He met with a bunch of, you know, for-profit insurance industry banksters. And they said, oh, yeah, don't worry, everything will be fine. Right. Tell that to you, you know, when the claims adjuster or whatever. I mean, it's just, you know, I'm not buying this. So, anyway, I'm talking about restaurants. And yesterday I was pointing out this little laser gun that will measure your temperature, and my head is 94.1 degrees right now. So, and I mean, it doesn't measure your internal body temperature; it measures your skin temperature. But that's not a fever, right? That's normal temperature on your skin. And California restaurant is doing this now. I said, you know, yesterday I said, hey, restaurants should start doing this. I would have felt a lot more comfortable when we went to dinner with our daughter and son-in-law a couple nights ago if the maitre d' had measured our temperatures and had assured us that all of the people working in the restaurant had to go through that before they were allowed into the building. And as was also the case of all the people sitting around us, but that didn't happen. Well, it's happening in California. Sichuan Impressions has restaurants in Los Angeles, Tustin, and Alhambra, California, 3 restaurants in the state. And they said if they are using an infrared thermometer, just like the one I was demonstrating on TV yesterday and telling you about on radio, you can measure a temperature from, well, with this one right here, I can measure a temperature from 20 feet away. The ones that are designed to measure, you know, your actual body temperature, like they would use in a doctor's office kind of thing, or you could use at home. And again, these are $20 and $30 devices. You know, you have to be a foot away, more or less. But in any case, they're using this infrared thermometer, and they have been since January. A Chinese restaurant in the United States has got on this thing in January when Trump was still out there playing golf. And they go on to say if a person has a fever, the restaurant will help contact local medical services. And those who don't comply with the temperature check will not be served. In other words, basically, if you've got a fever, they're going to presumably ask you to leave. And if you don't leave, they'll call an ambulance for you or something. Somehow they're going to make it work. So, like I said, it'd be nice to go to a local restaurant. There's some of our favorite restaurants around here, but ain't going to happen until I know what's going on. And I think most of America is feeling the same way. This is not hysteria. Not when, just 200 miles from here, a dozen people are dead. This is reasonable and rational. So my question to you is, how has the coronavirus affected you and your family? Are you changing your habits? Or do you think this is all hysteria? I mean, here, this is Rahim Kassam wrote, he's a reporter, wrote, there were actually 2 people at CPAC who were infected. They shared a room throughout CPAC. This was just texted to me, he tweets, from a high-profile CPAC attendee. Went to the doc today at the VA, referred to the health department if I want to test for COVID-19. Doc told me health department, so this is somebody who was at CPAC, right, who they think might have met the infected person. But remember the Republicans, they wanted to tell us, they wanted the whole world to know who the whistleblower was, who blew the whistle that Trump was trying to extort the president of Ukraine? Well, those same Republicans don't want to tell you who the guy was at CPAC who was infected. It's still a secret. We don't know the name of this person. So, again, this guy tweets, went to the doctor today, the VA, at the VA. I was referred to the health department. I want to test for the COVID-19. The doc told me the health department won't give me the test without the full name of the person who was diagnosed positive that you came in contact with. Your symptoms are irrelevant. You've got to give the name. And so this person couldn't get tested even though they'd been at CPAC. So in some of the replies, one of them says, so random person on a plane touches the seat buckle, picks up the virus, can't get tested because they don't know the name of the diagnosed person? Yes, that's correct. Carol tweets, I can't get the test. I'm very sick. I'm 63 years old. My 89-year-old mom lives with me. Trump is killing us, and so on. So this is the Twitter thing. A reporter with the New York Times, Robin Schulman, went to Toronto and came back, and when they were going through the airport in the immigration area, their flight was commingled with a couple hundred passengers from a flight from Shanghai, from China. And they're all using the same touch screens to answer the immigration questions, right? Are you carrying $10,000 and all that kind of stuff. And the agents who were asking them questions were wearing masks and gloves, but they weren't. And so, then she gets home and she's got, a couple days later, she's got a fever and a cough. And she's thinking, oh, my God. And she's got an aging mother who is taking care of one of her kids. And she could give it to the kid, and the kid could give it to mom. And so she calls her doc, and he says, go to the hospital and get tested. And she goes to the ER, and they say, no, we're not going to test you. So she goes home, and she has a fever of over 100 degrees the next night. And so she calls the doc again, or the ER, and they say, yeah, come on in. And so she goes into the ER, and they say, no, we can't do it. And then Mike Pence, so then the next night, Mike Pence comes out and says, anybody who wants to get tested can get tested. Any American, this is a verbatim quote from Mike Pence, just like today, oh, the health insurance industry is going to work with us. Don't worry, everything's fine. Well, this is what Pence said last week, quote, any American can be tested. We're removing that barrier. And of course, Donald Trump said, anybody who wants to get tested can get tested. So she goes back for a third time. And again, the doc says, no, we're not going to test you. So, she's a reporter for the New York Times. So she calls up the spokesperson for the hospital and says, I'm writing an article about my experience at your hospital for the New York Times. And all of a sudden, they're like, oh, well, come on in, we'll give you a test. So I guess that's how you get the test.